Good morning, everyone. Welcome to Team TDF Wellbeing Webinar. My name is Irena Piotrowska, and I am one of the practitioners at TDF. I am an acupuncturist, and today we are going to go over a protocol according to Chinese government guidelines. This protocol has 4 stages. We are going to do the first one. It's protocol for treating COVID-19. Previous to webinars, I was showing you how to do protocols when you suspect that you have COVID-19. And today we start doing protocols. We'll do 4 webinars on them when you have COVID-19 and what to do regarding on the stage of the disease. So today is the initial stage of the disease that we are going to work on. This is all according to article published in Journal of Chinese Medicine in June 2020. It's called Acupuncture in the Treatment of COVID-19, an exploratory study. It's freely available, so I encourage you to download it from the website in case you need it. And the other things you may need is how to use the acupuncture point, and we are going to cover that today. Today we are going to do the initial stage of COVID-19, how to treat COVID-19. Remember, you are all of your videos and microphones are switched off. No one, including me, can see or hear you. TDF is a charity that relies on donations, so please give if you can. Make yourself comfortable now and minimize distractions. Always talk to your GP first, or if you have any doubts. Remember, it is a complementary treatment. Each webinar covers one topic, and I explain location of every point from basics during each webinar. So if you are here for the first time, I am pleased to welcome you, and I hope you'll enjoy this session. The guided part of the session will last for 30 minutes. And I will talk you through the protocol for initial stage of having COVID-19. Close your eyes if you feel comfortable to do so while you are pressing the points. I will summarize what we are going to practice today at the end of our webinar. Please remember to participate accordingly to your own abilities. Acupressure has no side effects beside possible bruising and soreness of points. Please apply an amount of pressure that you feel comfortable with. You can stop and start at any point during the webinar. You are in charge. The session will end around 12:30. So let's start doing the points. I will set timer on. So the first point is lung 7. It's located here. So place your hand like this, abduct toe. You will find the sniff box there, and just move your finger directly over the bone, and then you will find yourself in between 2 tendons, and this is the point to press. This is styloid process of the radius, and the point is here. So this is the first point. First 6 points we'll do together. We'll press them simultaneously. So let me show you where's the second one located. Let me make myself more comfortable. So the second point, when you slide your finger, this is the medial malleolus, when you slide your finger underneath it, this is the point. So first, lung 7, lung 7, and kidney 6. And press these points. We'll press them for 1 minute now. Make yourself comfortable. I have to show you how to make it, so I'm not comfortable, but please make yourself as comfortable as possible. Just use your imagination and do what you can, or ask someone for help. You can always ask someone for help. Acupressure can be done yourself to yourself. You can do it to someone else can do it to you, or you can do it to a child as well. There's no age restriction or acupressure. When you do acupressure to children, use little pressure, like if you were checking if the cake is baked. So press these points. It's best to press them perpendicularly. Then we switch to the other side. So we find again lung 7. Just abduct the toe. This is the sniff box. Slide your finger through the stelloid process of the radius, and you've got this point, yeah? And the other point, you can always mark with your nails. See what I did it? And the other point is located below the medial malleolus. Just find the medial malleolus and slide underneath it. And you'll find a depression there. And now you can press both of these points. Let's press them. So ideally, these 6 points that we are going to work on in pairs, ideally press them perpendicularly. Press them perpendicularly and keep on pressing, or do motions, circular motions, one direction, the other direction, or press and lift, press and lift. It's up to you. But ideally, when you press points, it's ideal to feel warmth and slight soreness. That's how you know that you have stimulated the point. We are going to press them just for a minute, each one for a minute. So it's not ideal time to have an effect of acupressure. There's just many points, and I want to show them to you, so you can make use of the article I mentioned earlier at home. So just press. Now we are moving to second pair of points. First one is pericardium 6. When you press your fingers below the rest, like this, ring finger, middle finger, index finger, the point is under the index finger in the middle between the tendons. See, there are tendons, and this point is in the middle. So again, like this, the point is here. So the coupled point to this one is spleen 4. Spleen 4 is located on the medial side of the foot, and this is when you slide your finger on the first metatarsal bone like this, you will find this point. It's right at the base of the point. So now we have this point. You slide on the first metatarsal bone until you feel the base of the bone, and you go a bit under the bone, and here the point is here. So let's press it for a minute. Try to press it perpendicularly. If you are not sure about the exact location, there's absolutely nothing wrong with pressing a bigger area. It's okay. Just just remember that there's something you can do to help your body fight the disease. So let's press like this, doing slight motions. It's up to you, but try to remember to press it perpendicularly. If you do circular motion, you do circular motions. Repeat. And we are going to the other side. So again, pericardium 6, place your hands like this, and the point is right under the index finger. Yeah, you start at the wrist, and it's right here between the tendons. I'll make mark for it. Now we'll find the other point. You slide finger on the first metacarpal bone, and you will feel there. It is very sensitive today for me. You can feel the base of the bone there, and oops, and you press these 2 points at once. So let me repeat. We are going through a protocol based on guideline, Chinese government guidelines. There are 4 stages in the disease according to these guidelines. We are doing the first stage, the initial stage of disease. The next 2 points that we are going to work on is Sanjiao 5. It's located 2 thumb width above the wrist on the other side. They are actually on the same height of the on the hand, only on different sides of the arm. Yeah. So one is here and the other is on the foot. To find it, slide your finger between 5th and 4th metacarpal bones. And now flex your fingers and you will feel the tendon here. So the point we are looking for is right behind the tendon when you slide from toes. So this is the one. And let me see, did I do the mark here? Yeah. Oh, repeat. So flexion, extension, you can feel the tendon. Flexion, extension, feel the tendon, and press this point. Again, perpendicularly. If you feel warmth and soreness, this is where we are going, what we want to feel. Press. This is Sanjiao 5 on the arm, and on the foot is gallbladder 41. Just press. You may press and lift. Press and lift, or press, keep on pressing. Do whatever you are comfortable doing. Just try to stimulate the point. So now it will be easier because we'll do single points, at 1 point at a time. So the first one, when I say 1 point, it's usually 2 because they are located bilaterally on the body. We're symmetrical. So this point is large intestine 4. If you place your hands like this with your thumb against between the 2 metacarpal bone, first and second metacarpal, then the point is right here. Yeah, it's a length of the tip of the toe, length away. It's between first and second metacarpal bone. If you are pregnant, don't use this point. Don't press it. This is contraindicated in pregnancy. So again, just slide your finger, toe here, thumb, I'm sorry. And this point is located slightly closer to the second metacarpal bone. Now we'll do the other side. Just place your hands like this. Your thumb between the 2 metacarpal bone in the middle, and slide it in. and press. Again, if you are pregnant, don't use this point. Just press. You may do circular motions. You may press and lift, press and lift, press and lift, press and lift. You can press this point when you are commuting to work, for example, and you can do them simultaneously. Yeah, just like this. Press, not of course not when you had COVID, but in general. Okay, next point we are going to do today is lung 5. It's located in cubital crease, and it's located to the radial side, to the thumb side of the arm. It's located here. There is the tendon, and it's located to the thumb side. And just press. We're going to press each point for a minute, but let me say it again, stress it again, to be sure that you have stimulated the point, manipulated long enough. You should feel warmth as the area and soreness, bit of soreness. That's how you know that you succeeded. But repeat. And then the other side. So the tendon is here, the thumb is here. Let's go on the thumb side. Yeah? Oh, sorry. Let's go and press. Make yourself comfortable. Just press. You may do circular motions, one side, the other way. Like this motion, head to toe motion, or arm to fingers motion, or press constantly. Do whatever gives you the sensation of warmth and soreness. Just press. The next point is located between sternocostal angle. You follow the ribs. The angle is there. And the umbilical, and it's in the middle between them. It's REN 12. So between the sternocostal angle, follow the rib cage, and belly button in the middle. Just press. Press. So this is point located on the midline. So it's just one point. There's no 2 points when I say 1 point, and then we go on both sides. This one is in the middle. This is 1 point. Just press. The next point is located below the knee. So you need to find, this is the tibia bone, and this is fibula bone to the side. You need to find the head of fibula, and that's slide anterior and inferior from it. Yeah, you find fibula, head of fibula, and then slide to the front and below, like one thumb width away in one direction and the other direction, and just press. So it's time to switch sides. So again, we are looking for head of fibula. It's under the knee. So, and then we slide to the front and under. It's easier to make with your toes because that's the size of slides. Like with the toe, you can find it more efficient. And press. So I'll repeat again. You need to find the head of fibula and then slide anterior, inferior. And there we are. And here's the head of fibula. Press this point. Head to toe motion or circular motions or just constant pressure or press and lift, press and lift. Okay. Now we are moving to the almost last point, last part one. So this point is gallbladder 40. It's located below the lateral malleolus. You have to go under the malleolus and a bit to the front. Anterior and inferior. You will find here a depression. So under, anterior, inferior, and anterior to the front. Under and to the front. And this is the point. Gallbladder 40. My daughter is always making her own arrangement with the shells. So we now switch to the other side. So again, we are going to find the malleolus. Lateral, we go under it and to the front, and we'll find a depression there and press. So malleolus under and to the front. And this is gallbladder 40. Press and lift, press and lift, press and lift. Circular motions cover bigger area, so it is very good to just make sure that you're at the right spot, on the right spot. Oh, sorry. And the last point that we are going to do today is stomach 36. We know this point. I left it for the last one because it is the point that press daily will help us strengthen our immune system. So it's located below the knee. There are two right under the kneecap. There are two depressions. Place your hand on the level of these depressions, and this point lies hand width below, and here is tibia, anterior crest of tibia, and you just slide to the side, and the point is located just right here. So it's hand width below the kneecap, and one middle finger width away from anterior crest of tibia. I'll make mark with my, did it work? Yes, with my nails, and I'll find the other point. So again, here are the depressions, and so the point is located right here. Yeah, depressions, hand width below it, and middle finger width away from the anterior crest of tibia. So let's here. Let's press these 2 points. You should press them for 5 to 10 minutes, depending. Sorry. It's about, oh, I lost them. It's about feeling the warmth and soreness. I left it for the last thing to do, because we are going to press them till the end of this session, because this point alone, just this one, if you press that daily till you feel warmth and soreness, it will help strengthen your immune system, so your body will have better chances of fighting whatever comes your way. So just press this point daily. This is one of the most famous points in acupuncture. So let me repeat. Today's session covered protocol according to Chinese government guidelines, and this protocol was published in the Journal of Chinese Medicine. It's called Acupuncture in the Treatment of COVID-19 and Exploratory Study. So you can Google it, download it, and keep it safe in case you need it. Today we went through points needed in initial stage of the disease. According to the guidelines, Chinese government guidelines, there are 4 stages of disease, and this is the first one. You may have, if you have COVID-19, and this is the stage, you may possibly have fever. Please continue pressing the points. You may have dry cough, dry mouth. You may feel tired or fatigued. You may have chest tightness, vomiting, or diarrhea, or just nausea. So this is the first stage of COVID. And the points we went through today will help you in this stage. We need to stay at home when we suspect we have COVID and when we have COVID. So this is an additional way of helping yourself when you are not in really bad shape, and this is the initial stage of disease, and you may use acupressure for that. It's very handy. It can be done by yourself. You have the protocols in this article. Please download it. I'll say again, please continue on pressing the point. It was published in Journal of Chinese Medicine in June 2020. It was made clearly available. I'm sorry, I have a problem today with pronunciation. And the article, it's called Acupuncture in the Treatment of COVID-19, an Exploratory Study. So I advise you to download it right after the session if you haven't done it yet, and have a look at it. Read it, read the part that says about the treatment. We are going to go through all the stages of the disease, and we will learn how to do acupressure, so you can always apply it to yourself or somebody in your household. I hope you have enjoyed today's session, and that you will download the article. Thank you very much for participating, and please attend again. Please else tell your friends and family. If possible, and if you like the session, please support the charity's work. Thank you very much. Have a lovely weekend and stay healthy.